85% of heart attack and brain stroke, chest pain, happen because of this. There's a shocking truth, one that's absolutely critical that most people have never heard. Over 85% of heart attacks and strokes don't actually happen because of cholesterol plaques slowly clogging the arteries, as many believe. The real cause, the thing that often kills people during a heart attack or stroke, is something entirely different: a blood clot. Yes, it's the blood clot, not the plaque or cholesterol, that's the real culprit. And here's what makes it dangerous. It can form in less than 5 seconds. It doesn't take years of slow buildup like you may have thought. So why are blood clots so deadly? Because they can travel through your body. And when they reach the wrong place at the wrong time, your heart, lungs, or brain, the consequences can be catastrophic. If someone told you that you die because of cholesterol clogging your arteries, they didn't tell you the whole truth. What can actually kill you the fastest is a blood clot that moves at the wrong moment and blocks the wrong vessel. But let me be clear, blood clots aren't inherently bad. They're part of your body's natural defense system. When a blood vessel is damaged, your body forms a clot to seal the injury. Once that job is done, the clot is supposed to dissolve. The real problem begins when the body can't clear these clots fast enough, often because of chronic inflammation, high stress, toxic buildup, or high blood pressure, all of which cause microscopic injuries in your blood vessels. That's when disaster strikes. Imagine a large clot forming in your leg, a condition known as deep vein thrombosis or DVT. You may notice one leg swelling, feeling tight, warm, red, and painful, often like a cramp. But here's the terrifying part. If that clot breaks loose and travels to your lungs, it can cause a pulmonary embolism, a life-threatening emergency. You may suddenly struggle to breathe, feel chest pain, especially when breathing deeply, experience a rapid heartbeat, cough up blood, feel dizzy, or even pass out.
Now imagine that same clot blocking blood flow in your heart. You're now having a heart attack. You may feel intense chest pressure, pain spreading to your left arm, shoulder, back, neck, or jaw, along with shortness of breath, nausea, overwhelming fatigue, and cold sweats. And if a clot blocks blood flow to your brain, that's a stroke. Remember the FAST rule. Face drooping on one side, arm weakness, one arm can't stay raised, speech difficulty or slurred speech, and most importantly, time. Don't wait. Call emergency services immediately. Every second counts. The longer the delay, the more brain cells die. And once they die, they're gone forever. Here's what you must know. The biggest trigger for deadly clots is not cholesterol or calcium buildup. It's vascular inflammation, chronic stress, and microscopic damage to your artery walls. Things you can't see or feel and that won't show up on a blood pressure cuff. In today's video, we'll break down exactly what's damaging your arteries from the inside, and more importantly, how you can protect yourself from these silent, life-threatening clots. If you've ever lost a loved one to a sudden heart attack or stroke, please stay with me, because what you're about to learn could save your life or the life of someone you love. Number one, and people know this, is inhaling smoke from cigarettes. Now, your arteries are exposed to all these chemicals, and it's going to create inflammation. Also, pollution, or being around any type of chemicals in the environment, can do that as well. A solution is not to do vaping, okay? You need to just stop smoking. Alcohol is another one. You're drinking alcohol, it's considered a poison to the liver, it gets into the bloodstream, and that also can create problems on the inside of the arteries. Believe it or not, birth control pills or hormone replacement therapy is another thing that can actually affect the arteries because of the hormonal interaction, increasing the risk of a stroke and heart attacks.
Then you have stress. And this is an interesting one because there's something called the broken heart syndrome, where someone has a loss of a loved one and the risk of having a heart attack goes up by 2,000%, which, by the way, triggers the clotting action. Anything that increases stress can increase the clotting action. Also, surgery. Okay, surgery is a very stressful thing to the body. And endurance sports, marathons, it's a tremendous stress on your body. and refined starches. That's just like pure inflammation going through your arteries. And this is why diabetics are at 4 to 5 times the risk for getting clots, not just in the heart, but in the brain as well. The last thing that can trigger these clots is an infection. It could come from an infection in your tooth from a failed root canal, or you had this abscess that's leaking bacteria into the body, or it can come from some other chronic infection. I think for most people, it's going to be the high levels of sugar that's flowing through their bloodstream that's creating the problem because of their diet, and it makes their blood really sticky. Also, chronically elevated inflammation. Inflammation is one of the most potent things for clotting. There's another trigger for this clot as well, an excess amount of calcium in the arteries. And let me explain this because in certain studies involving postmenopausal women who take high amounts of calcium for their bones, they have an increased risk of getting this clot because calcium is involved in over 15 different clotting factors. I'm talking about excess calcium. Excess calcium is just not good for the heart. It can cause excessive calcification in the soft tissues, especially in the arteries.
Number 1 is vitamin K2. The main purpose of vitamin K2 is to direct calcium to the right places. Instead of letting calcium just build up randomly in soft tissues, especially in the artery walls causing hardening, K2 helps shuttle calcium into your bones and teeth where it's actually needed. Simply put, K2 helps keep your arteries clean and flexible. And guess where vitamin K2 comes from? It's abundant in fermented dairy products like Japanese natto, egg yolks from pasture-raised chickens, butter from grass-fed cows, and animal liver. Fatty foods that some people might still be wary of because of cholesterol, but are super rich in K2. You should always remember that vitamin D and vitamin K2 are a perfect pair. Vitamin D helps your body absorb calcium, and K2 makes sure that calcium is used correctly. Plus, vitamin D is also super important as a powerful anti-inflammatory for the inner lining of your arteries. Next up is magnesium. This is an essential mineral that acts like a calcium gatekeeper, helping to prevent too much calcium from entering cells and soft tissues, including artery walls. Magnesium also helps relax blood vessels, improves circulation, and is especially important in preventing heart rhythm disorders, particularly atrial fibrillation. Atrial fibrillation is a heart rhythm problem that can cause blood to pool in the heart chambers, significantly increasing the risk of blood clots. So, what else helps lower the risk of blood clots? A hugely important factor is nitric oxide. This is a miracle molecule our bodies produce naturally that helps dilate blood vessels, allowing blood to flow more easily and preventing platelets from sticking together. Some things that can help your body boost nitric oxide production include vitamin D, there's vitamin D again, L-arginine. This is an amino acid your body uses to make nitric oxide. Some of the best natural sources of L-arginine are red meat, especially from grass-fed animals, poultry, fish, and liver, foods that sometimes we're told to limit. Sunlight. Sunlight doesn't just help your body synthesize vitamin D, it can also penetrate deep into the body and stimulate nitric oxide production right inside the artery walls. This is why getting sensible sun exposure, not baking in harsh sun, is so valuable for heart health. Don't be overly afraid of sun exposure because of the risk of skin cancer, melanoma, like a lot of information since the 1980s has led us to believe. Regular, moderate sunbathing is actually very good for the heart. Besides these, there are many other natural warriors that can support you. Polyphenols. These powerful antioxidant compounds are abundant in natural herbs like green tea and brightly colored fruits and vegetables. Vitamin C helps strengthen blood vessel walls. Omega-3s. Omega-3 fatty acids found in fatty fish like salmon, mackerel, herring, flax seeds, chia seeds, and walnuts naturally thin the blood, making it less likely to clot. Vitamin E, a powerful antioxidant that helps protect cells and may help prevent blood clots. You can find vitamin E in almonds, sunflower seeds, unrefined vegetable oils, and whole grains. When it comes to vitamin K1, different from K2, okay? Which is abundant in dark leafy greens like spinach and kale, some people worry that eating a lot of it will increase blood clotting. But no, vitamin K1 is essential for your body's normal clotting process, helping blood clot when you get injured. Consuming K1 from food just helps bring your clotting process to a balanced level. It doesn't cause excessive clotting. Intermittent fasting is also a surprisingly effective way to help reduce the risk of blood clots. Fasting helps your body clean house, reduces inflammation, and improves many health markers related to heart health. Similarly, adopting a ketogenic diet, keto, a very low carbohydrate diet, also powerfully reduces inflammation in your arteries, thereby lowering the risk of clot formation. And of course, you can't forget about drinking enough water. Water helps thin your blood and improves circulation. When your body is dehydrated, blood tends to thicken, increasing the risk of blood clots. Regular exercise is extremely important. I'm not talking about high-stress workouts like running marathons every day, but regular, appropriate exercise for your fitness level, maybe brisk walking, swimming, cycling, combined with proper recovery. Exercise boosts blood circulation, prevents blood from pooling, especially in the legs, and significantly reduces the risk of blood clots. Garlic and onion, super important in preventing blood clots. Garlic contains allicin, which helps prevent platelets from sticking together. Ginger and turmeric, with its active compound curcumin, have strong anti-inflammatory and anti-clotting properties. Cinnamon and cayenne pepper are also known for their ability to improve blood circulation. As for supplements, there are 3 that are really powerful. Nattokinesis is a natural enzyme that helps prevent blood clotting. You also have another enzyme called serrapeptase, which is an extract from silkworms, and then bromelain from pineapple. When you take those enzymes to help reduce clotting, and I'm not even recommending you take them unless you have a clotting problem, but they're a great natural source that's not endorsed by Big Pharma because they're competition. You want to take those on an empty stomach so they can actually work on the factors in your blood that might be too excessive.